they've asked me several times about what kind of training can we put together and put a course together and do a certification course around AI, and myself, as well as a couple other people that are technical in the technical world. We're looking at them going, by the time we get it out there, it won't be relevant.
You can't do that.
You're listening to the Help Me with HIPAA podcast, where HIPAA and humor collide to make learning fun. Your delightful hosts are Donna Grindle and David Sims. Relax. HIPAA help is on the way.
Welcome to episode 449 of the Help Me with HIPAA podcast. My name is David Sims of HIPAA for MSPs, and joining me is Donna Grindle, all the way back from the HIPAA Summit. She climbed to the top. She's seen the light.
Yeah, I was in this chair watching it for 3.5 days. Yeah.
That's hard work. Sitting still for 3.5 days.
Yeah. I mean, everything was so pretty much intense, and there were so many sessions, and there were simultaneous ones, and there's some I got to go back and watch the recording because I couldn't watch them simultaneously because I can only do so much.
Why not? You got multiple screens. You could have had them up.
I know. Yeah. Well, we know what would have happened if I had too many things to look at or think about. I'd have just been running in a circle.
Yep. So I have been perusing the notes for today, honestly, most of which we won't get to, but wow, what a bunch of stuff.
I mean, I've been doing this for over 10 years, sitting in, listening to what's going on. I mean, it's a huge piece of me being able to keep up with all of the different things going on with HIPAA.
Yeah.
And when I started, it was not 3.5 days.
Mm-hmm. Yeah.
You know, it's just like us. And all of this is doing is just telling you where we are and where we're going. Not how to do it.
I know.
They have entire other sessions now that you can sign up for from beforehand to teach you how to do it. Well, It's workforce training and that kind of stuff. So,
well, you'd sent me the notes and you said, go through and highlight the things you want to talk about. And then as I was going through it, I'm like, I'm highlighting everything. It's like, this is not going to work.
No.
You know, it's like, what do you prune and what do you leave out? It's tough. So in saying that, when we dive into it, we're just going to go until we can't go anymore.
Yeah, I mean, before we've done multiple episodes, but I don't even think we could do that with this one. I mean, it's so much. So we're not going to be able to do multiple episodes of what was covered at the summit. What we're going to do is an episode of what was covered at the summit, and then multiple episodes, including information that was covered, to talk about it.
Yeah.
So it's that much stuff. And, you know, I was just like, at one point, like, there are so many things that I couldn't even keep up with my own notes. I got lost in my own notes.
Well, we better get started. So
yep.
Before we do that, we do want to say, if you enjoyed today's show, go leave us a review. We appreciate it. So head on over to wherever you're listening, Spotify or Apple, and leave us a review. We appreciate that very much. And for those people who help support the show, thank you. Thank you. We love you guys and gals.
Thank you very much. Couldn't do it without you.
If you want to find us online, you can go to helpmewithhipaa.com. If you want to find Donna at her day job, it is cardinhq.com, and I'm at HIPAA4MSPs.com. All right. We do want to say the HIPAA Privacy and Security Bootcamp, which is a 3.5-day live privacy and security bootcamp that we put on in person. Mm-hmm. It's going to be April 9 through 12.
Yes.
So quickly coming up.
Mm-hmm.
Matter of fact, I had somebody today said, we're going to book a meeting with you on the 8th, April 8th. And I'm like, okay, that's cool. I go to my calendar. I'm like, oh, wait a minute. I'm traveling that day. I was like, no can do.
Yeah, that's not going to happen.
But looking forward to it. So tell us a little bit about what to expect for those who are lucky enough to come to the Price 8 Bootcamp.
Well, the fact that I am already updating sessions to include a whole bunch of stuff that was covered in the summit tells you that we touch on everything. But again, the boot camp is for the people that do the work of building and managing the programs. So whether it's IT or legal or administrators, compliance officers, privacy officers, business owners, it does not matter. It is something that everybody's having to do. And I can tell you that the way things are going, if you don't catch up now, I mean, I was overwhelmed. I've said that like 100 times to you as we're preparing for this session. And these are all things I know. There was nothing on the sessions that I wasn't like, okay, I'm looking forward to hearing that. But it wasn't like, oh, a totally new concept. Well, there was one that I was like, never thought of that entire concept. But we'll get to that one in a minute. Overall, though, there's so much happening in the industry, specifically with privacy and not just cybersecurity, privacy concerns, as well as data security and the cybersecurity things that gets most of the news. There is so much happening. And where we are right now, a year from now, we're going to do an episode to go back and say, wow, look at all the things that happened. It's going to be that there's so much that's about to pop that it's overwhelming. So we're going to take you through how to do the work to build that program and maintain it, even in the vision of where we see it's going. You're going to have to do some things to maintain it. And we'll talk more about that when we get through the details.
Yep. All right. So if you want to know more about that, you go to PrisecBootcamp.com or thehippabootcamp.com, because we've mixed it all together now.
I know, right?
And you can learn more, and hope to see you there. All right, let's dive into some HIPAA Say What, because there is a mess happening right now as we're recording this.
I know. We talked about not having this section because there's so much to talk about, but this is so big, we got to talk about it.
Yeah. So we've talked before about this ransomware gang, Alf V, or we just call them Black Hat because, it's easier to do that. And one of the things that has happened lately is they got, shall we say, a bit perturbed at the healthcare. Well, maybe I guess they got perturbed at the law enforcement side of things, and they decided to take it out on healthcare.
Well, all the critical infrastructures. Healthcare is just a easy target.
Yeah, that's true. If you could target all of them, but the healthcare section is going to get hit the worst because of all the reasons that we always talk about.
Well, I do worry about the nuclear ones so that we don't, and then, it's a whole different world, but.
Yeah, we won't care about healthcare at that point.
No.
But, So take us through what is going on right now with Change Healthcare and the outages, because some folks, especially those outside of healthcare, you're probably looking at that going, yes, it's yet another hospital system that's had a cyber attack. Okay, nothing new, just continue on. That's not exactly how this one is.
No, this one's huge because it's not a healthcare system. It's a major vendor that operates within the healthcare system, allowing money and claims and orders for prescription drugs to fly about the systems. And the fact that the payers use it to get the claims and then pay the claims, and the providers use it to request the prescriptions, like electronic prescriptions. If anybody's had any kind of script done in the last few years, it's done electronically now. And that is the backbone of the vast majority of those transactions runs through this one vendor. And this vendor is one of the many, I don't know, is it a subsidiary? Is it a division? I don't know. But it's a huge part of United Healthcare Group. which is a massive collection of companies that started from the, insurers who now really are controlling so much of the market. And that one piece, and that, of course, they're really clear in that it only hit Change Healthcare, didn't hit our other stuff, Well, this one is like, we're reading things like outages are causing a financial mess for doctors. There are groups that they're not being paid for things that they have had to buy. They buy the medication and then, provide it to the patients in treatment, and they're not getting paid. They can't get the claims through. There's a lot of things that are being impacted, from small doctors to the major health systems and everything. To the fact that this group, Change Healthcare, has now spun up a separate prescription, electronic prescription tool for everybody, and you're having to convert to that. And 90% of the retail pharmacies are using it as of Friday, they said. They're having to convert over to using this other thing they've set up, and they're doing loans that are no fee, no interest loans to cover this, which means it's just going to put the effort on the back end. Now you're going to have to go through all that reconciliation, but you're forced to get these loans, and even then, your patients can't get their scripts. So
wow.
It's a nightmare, and this is a huge reason that we say you have to consider all of your vendors in your incident response plans, and you better ask, are your vendors considering you in theirs? Because why wasn't this something that they triggered and had prepared? Why, and the American Hospital Association is really pounding away on how they're responding, and they're pretty angry about it. Because, you think about the volume of medication claims and money and actual medication that needs to move through a major health system in a single hour, much less weeks. And that's where we are.
Wow. Yeah, and you mentioned the software that they rolled out. I would imagine it's not something that they created, last minute, but anytime you're rolling something new out, my first concern is, was this vetted at all? Do we know anything about the security of it?
Mm-hmm. And that's exactly what everybody's thinking is, what have you done here?
Yeah. Are you just going to make problems worse? Think about the cost of switching, because that's what we're basically doing. We're switching to another piece of software. What does that look like internally for all their clients? Because now the buttons that used to be on over here are over there, and how do you get to this or that? And
what can I send versus what I can't?
Yeah, it's taking longer to do things because it's a different interface. Oh man, there's a lot. But you're right. If I'm doing business with that vendor, I need to ask myself, if this vendor has a problem, we have to completely cut them off, then what is my alternative operational procedure to get around that?
Or if they have to they cut me off.
Yeah.
Because that's what happened is they had to cut everybody off. And I want to know what their plan is.
Mm-hmm.
That's the thing. I want to know what their plan is if one of these attacks happens. And it's clear. Everybody always assumes, well, they'll just be back up and running in a couple of hours. What do you say to that, David?
Wrong. Well, I'm just thinking, like, even a week or so ago, within the IT world, we had a big scramble because of a vulnerability within a remote access tool. And, I am very, very much a micro example. But I had to shut down remote access to all my clients, which for us internally, we have an alternative form of being able to do that. But we do have clients that actually use that service. They backbone off of that. So they remote into their own computers instead of having a secondary tool. And so, we had that same thing happen where we had to call clients and say, I know you use this to get to your computer so you can work remotely, but we're shutting it down until we are confident that the vulnerability has been patched. We're shutting this down. And of course, my internal plan was, if this takes more than a day, then we will have to have alternative measures for our clients to use. We have alternative measures immediately to use, but that's not something we can push out to clients. Fortunately, it was something that was, we had it back up in, I think, 3 hours or something like that. So it's pretty quick. But, from the very start, I was thinking, how am I going to address this?
So there you go. It's something else that you even have to figure out. How would you handle it if you had to keep it cut off for a week? What if there's no fix for the vulnerability? What if it's identified, but you can't do anything to fix it? How are you going to deploy a solution? All of these kind of things become huge. And so anyway, we need to get to this is big stuff.
All right.
And,
then let's
we would have a whole episode about this whole stuff that's going on and do some, let's see what's happening in live discussions. But we ain't got time for that.
All right, then let's jump on over to the 2024 HIPAA Summit review, as seen through the eyes and ears of Donna Grindle.
Seen through the ears. There you go. All right, so there's three big things, and I wrote up for all of the club members, and if you're HIPAA for MSP, Garden Club All-Star, those folks, I wrote up a memo with my top three things and my thoughts about them that I posted in the forums today. So, they've got a lot of details. This is just another bonus point. But in what I sent them, my top things were, everybody needs to realize that OCR has announced just last week that they're doing an enforcement initiative involving security risk analysis.
Hoo-hoo.
So that being said, let's understand the last time they did this was 2019, and it was about patient right of access. And they have announced 46, I think, up till whenever this is being recorded. I think it's 46 different enforcement actions that didn't even start till the very end of 2019. Then you had, not a lot happening in 2020, and they've still managed to do 46 different enforcement cases. And they announced they're still getting complaints, so that one's not stopping either.
Yep.
And if you look at, how many times do we say it's in every one of the security rule issues where it was a security rule failure in an enforcement action, failure to do a complete and thorough security risk analysis is almost always one of their HIPAA violations.
Yeah.
And be clear, that is a violation of the law. It's not like, oh, I didn't do this step right. That is an actual violation. And, it was like when they were saying that, I was like, hadn't really reinforced that part of it, is to say, this is not just you doing it wrong. This is you are violating an element of the law.
Yeah. Well, the other piece of that part, and I know you see this and I surely see it, is people want to often look at, are we quote unquote compliant? And they're just talking about all these things they have in place, but they either skip the risk analysis or assessment altogether, or they don't do but once every so often, every 5 years or, whatever it is.
Well, and Director Fontes Rainer, I think how she says it, Fontes Rainer. She made a point. There's three things they're going to be looking for in these enforcement cases. Number one is not doing one. Okay. Or probably if you've done one every 3 to 5 years, probably not going to meet the requirement, but it might be better than not doing one. However, the next two are probably going to scoop you up if you've been doing them, every 3 to 5 years or even every 2 years. is the second one is you do something, but you're doing it completely wrong. Which is, what we've talked about before. The number of times that we get something and it's really a gap analysis, not a risk analysis. And years ago, OCR published a whole thing on, here's the difference. Let me explain the difference between the two. So that's another thing. And then the third thing is, even if you do one, but then you're not doing anything about it, it's just the same stuff showing up every time you do one. Mm-hmm. They're like, yep, that's still a high risk. Moving along now. But I checked the box. I did the risk analysis. Yeah. I just didn't do anything about managing the risk, which is another violation. Yeah.
And we've seen those. It's like, hey, this SRA you did like last year, you identified this was a problem. What did you do about it? We identified it was a problem.
I know. Those are the ones where I'm like, okay, what are we going to do? How are we going to handle this? Because the good news is, if you're doing those things, when we come in, we try to figure out how to resolve where you are. Mm-hmm. We don't just go, well, you screwed that up, let's move forward. How can I take that knowledge and turn it into a positive is always what I'm trying to figure out. The problem is, if you've got 4 or 5 of these, which some people do, that have the same problem on them over and over and over. Mm-hmm. With absolutely no response, no plan. And sometimes you just need to document the fact that that's a risk you're willing to take. Wherever that risk is, I'm willing to take it. Okay, well, that's your business decision, but at least show you made one.
Yeah.
So those are the big things, and that's going to be pretty interesting. There was a detailed review of the CPGs and how the CPGs, if you're meeting your HIPAA obligations, most of the CPGs are also being met. So again, it's just like with hiccup. If you're doing the things, then you're handling the new things. So as new things come out, if you've been doing these things, you're just like, okay, I'll just adjust my documentation. That's it. That's what we're doing, is going through and saying, how can we beef up in some areas because of some specific things that are mentioned in the CPGs. And I'm completely redoing how we're going to assess for recognized security practices, which we've been doing for years now. I'm redoing that assessment completely from scratch using the 2023 hiccup and the CPGs in my considerations of the controls that we're going to be looking for. So, but that wasn't a lot of news for us. It was just reiterating the plans are the right ones, except you better hunker down on your SRAs. So they've pointed out they've done a lot. Now, there's a couple of other things they did mention, which was, definitely going to update the security rule. They're looking into how they can do that. They're looking into ways they can provide assistance during a cyber attack, which is something we've all talked about, of having like a response team, almost like and it's not really, but almost like, how FEMA responds to a disaster. We need something like that for major cyber attacks.
I wonder if they would have any luck if they tied that ability to assist into your HIPAA program. In other words, if you're not doing jack, we're not going to spend resources to help you. It's kind of like help those who are help themselves.
Yeah. And we'll see, but that's the problem, is sometimes you don't learn how to help yourself until after you realize, because there's so many people we run into and they're like, yeah, I got this. this. And then once we start really probing, they're like, maybe I don't have this.
Yeah. It's just, when we start talking about carrot and stick, I just wish there were more abilities to have the carrots out there that were meaningful enough to people to pay attention. I still think there's some good things out there with recognized security practices, but
great stuff.
You get the same kind of, that's nice. I'm like, no, you don't get it. Like, this is fantastic. You should be taking advantage of this. Yep. Yeah, that's nice.
The number of sessions people have brought or signing up for me to do in different organizations are specifically related to the things that you can do with HICAP and CPGs and why those are important, and utilizing those tools to better prepare you for the cyber environment we're in. And every one of them has some flavor of that happening. And it's, that's why we just publish. Here's the list of the ones Donna does. Figure out what you want, kind of combine them. We got it. Let's do it. But it is that. And it is, how can we better support the industry in doing the right thing to prepare ourselves? And that's key. And then providing support when the bad things happen. Used to the assumption was if I did all the things, then I didn't have to worry. Because I did all the things, I don't have to worry that much. And that's just, we haven't lived in that world a long time. They're also looking at some ways that there's, as they pointed out, there's a fundamental misunderstanding by patients about what HIPAA does and does not cover. And unfortunately, also providers. And finding a way to better educate about those things. They did bring up that there are some apps in the app stores that are saying they are HIPAA certified, or that they are in somehow HIPAA compliant apps. And they are working directly with the FTC so that patients are redirected to the FTC when they see these claims in the app stores, which I think is pretty interesting, is that I think they're trying to get the app stores to look for those declarations and then put a note that says, see the FTC, you might want to consider a little bit more about that claim. Yeah.
And it's kind of the same conversation you and I have had for a long time about companies, businesses who make that same type of claim. We are HIPAA certified, or we can make you HIPAA certified, or even compliant. We can make you HIPAA compliant. That's not even something you can do.
You can operate in a HIPAA compliant manner. And that's what we say.
Yeah. I mean, I don't know about you, but even when I've asked OCR about how can somebody be qualified to be termed HIPAA compliant, like when they do a OCR investigation or a corrective action plan and all that, and the response I got was, we don't even tell people that they are, compliant with HIPAA, because you could literally be compliant, and before I get to my car in the parking lot, you're not.
And that is a key. So they're working. I think we're going to start seeing it. I think that's what they're trying to do, because the app stores, they're not designed to vet for that at all. But at the same time, their consumers need to understand that may not be a thing that you just can't educate the whole consumer market that that's not a thing. So they're trying to work it out so that when you see that, you are redirected to the FTC for you to learn about there's really no such thing as that. So it's good to see they're trying other ways to get the education out there, because it is an education thing. Some of the vendors don't even understand it. They're like, well, so-and-so said it was okay. Yeah. All right.
I got a seal.
Bub said I could put it on there. I asked my lawyer. My lawyer said it's okay. Well, how many HIPAA cases has your lawyer done? Oh, they say none. Okay. Just check it. Okay.
They're a divorce lawyer.
Yeah. It's but even a small business attorney is not going to be somebody that's done a lot with HIPAA.
Yep.
So they are setting their priorities based on the complaints and the breaches reported. So they're looking at what needs to change in our environment with here's clearly what's happening. I'm getting a ton of complaints. I'm getting data breaches. I mean, the only reason you have data breaches anymore we had fewer in number, but more patients exposed because they're getting more data.
Mm-hmm.
But I mean, not like dramatically fewer in numbers. It's not like they fell off no, it was just slightly fewer, but hundreds of them and that's only 500 or more. Just saying.
Yep.
But then the obligatory, well, let me touch on this one quick thing of the audit program. They did ask about where we mentioned, they kind of threw out that, hey, we're going to ask these people about this. And so they asked, what's up? What's up with that? And, the point was the audit program never just went away. We just haven't been, doing live audits, or maybe, we just haven't been, it's not like we closed the program, which we always knew.
Mm-hmm.
We keep waiting for them to bring that back up and fire it back up again. So they want to start them back up this year. Now that is considering all of the limitations they have with their workforce limitations and the number of investigations and changing the security rule and this. I don't know how they can do that, but that's what the intent is. And it's because if you look from, I think they said from 2017 to now, a 264% increase in ransomware reports.
Yeah.
So they want to, instead of, they're doing the enforcement initiative, but what they want to do is figure out how they can use the audit program as a training mechanism on, let me show you, here's all the things you should do differently to meet the requirements that you're supposed to meet. So things like, understanding that's a gap analysis, not a risk analysis. And I saw there was a session where an IT provider had told a small practice, don't worry, I'll keep you HIPAA compliant. They did not know what was happening. But the point was that the practice administrator was like, it's our responsibility to know. So we're the ones at fault for not knowing that that's not true. So, that is a big point. But anyway, they're looking at the 135 million patients that, a lot more, slightly fewer breaches, but a lot more patients. And again, we've mentioned over and over, there is a lot of pressure to do more enforcement. And then came the big discussion, which was in every session. If it had to cover AI. And there were a lot of jokes about, this is the obligatory AI discussion, but in almost all the cases, there was something else that I'm like, oh yeah, I need to worry about that too. Or it augmented something that, it only added to something I'd already added to the list. It added more context. But they did point out, there's a lot of hysteria about it, which is true. It sounds like it's new, but really and truly, I mean, AI has been in play for a while. When we've talked about machine learning and AI for years, and it's being in place. Yeah. What's different is the generative AI. It's gone to the next level, not the creepy level.
Yeah. Well, it's not hit generative yet. We're still dealing with the LLMs.
But they're still, I mean, GPT is generative, is what the G in GPT stands for. So they're looking at ways that as you ask it questions, it reanalyzes and learns more. And that's what it's all about. The point is, we're going to have to regulate it because it's the Wild West. And by regulating it, you're not saying, oh, we don't want this. We're just saying, gonna need some guardrails because this thing could go nuts. Yeah. And so the focus is they're looking at it from two perspectives. Here's one of the first times where I went, that's a really good point. They have to look at it from how it is being trained because there's bias built in based on the limitations of training. So if I don't train it to take into consideration women, then it's going to have a natural bias because it doesn't know it. Bless their heart, they didn't know no better because I didn't train it.
Right.
So they're looking at, we have this whole issue of how that could impact the healthcare system as a whole if we start relying on these tools, but we're not making sure that it's not got biases built into it because of the limitations of what it's trained about. Because I can assure you that there are certain things, if you train it to think that all the population is like this segment, it will not be able to make those decisions. I mean, there's crazy stuff they're learning now just because they're including more data. So there's that, which is a whole separate section they have to worry about regulatory wise, is to make sure not to force it to be a certain way, but to make sure that if it is being trained that way, it's used that way. And then the other thing is to make sure that it's being used appropriately, in a safe and ethical manner that we've already talked about. The criminals, they don't care. It's a free-for-all. So, they've got to look at it from both perspectives. And until the law changes, our risk analysis is the only thing we can count on for those two things to get done. So, risk of bias, risk of inappropriate answers, risk of cybersecurity issues, risk of poisoning. There's just a huge list. So we know that the SRA enforcement is a big reason that we really need that to get better, is because we have to do SRAs that we never even dreamed of doing.
Mm-hmm. Yeah. The downside of it is it's moving so fast that, even what you talk about today may not even be relevant in 6 months. Certainly not a year.
That was another big point of when it comes to AI, and there's so much discussion of it, you have got to get your organization. You doesn't matter the size or type of organization you have. You have got to get your hands around what is currently happening in AI, because they're like, everybody's gotten a real big surprise to learn how much is already being used, because it's already being used. I've got it being used in so many ways already, just in what I'm doing. So it's already being used. You have to understand that use. You have to understand that data. What risk is that bringing to the table? And then have a plan for the entire business to be able to evaluate the impact across the board on the tools that can be built. And here was an interesting conversation about the cool things that can be done with AI. So I always love hearing this guy. He's the privacy officer, security officer, compliance officer up there with University of Kentucky Medical Center. I think his name's Brett something, but he's really he's got his stuff down, and he's always eager to hey y'all, how about, he's telling you the great things and then the not so great things. You got to worry about both sides. But one of the things that they have been able to do, first you expect them to say, well, they've been able to evaluate patient flow and find ways we can make it more efficient. Awesome. Because you're improving patient care, the patient experience, patient safety. Great. But another thing they were able to use it for was to evaluate traffic patterns in the parking lots and improve traffic flow based on the time of day all this stuff's happening, which would have never been an option before. But they've been able to better manage the resources they have to control flows of traffic around the medical center. I know. But you think about it, it now knows, it can look at what kind of appointments are happening. Are we at a time where we have a surge in the emergency room? Because you always hear about that, and when does that surge occur? And is it bringing in multiple people? How many people are checking in here? How many people are checking out here? What is the normal time? It was amazing. So there's a ton of business uses never been thought of before that could, it would be used in BHI.
Yeah. Yeah. The data analysis part I think it's going to be phenomenal.
Well, I mean, I hope it helps us get more done with less. We're already getting more done with less. And
that's GPT-5. It's coming.
I just, I know you need this, so I'm going to do it for you. But the big things then, the three big areas, the biggest things happening with OCR, security rule changes, restarting the audits, and the SRA enforcement initiative. And so then the FTC did an update. We've talked about most of the cases already that they covered. Greg Garcia, the Health Sector Coordinating Council CEO. I just realized we need to get Greg on here with us. But, he was talking about the 5-year strategic plan and all the things that we've covered, and we just covered that. And, one of the key quotes from Greg, because I almost always am able to pluck a very cool quote whenever I'm hearing him, and none of us individually are as smart as all of us collectively. And that's what that plan is focused on. I thought that was a great point, gets back to that. But, AI out the wazoo, which is bringing in privacy officers. There's all of these vendor risk with the privacy people. And think about AI is now making your data an asset because of the sheer volume of requests you're going to have to let me de-identify your data and now use it to train my AI tool that I'm going to get paid to sell. What are you going to get out of it? Right. Mm-hmm. And they were bringing up the importance of that, number one. And number two, does your BAA allow people to de-identify the data and use it for their own purposes? Because that's what's happening. And it's your asset. And it never mattered that much or was that valuable before based on the sheer amount of money that's being thrown into this particular vertical AI, but within healthcare even more. Yeah. So big things along AI, what you've got to figure out. And if you don't sit down and understand what it means, when you say AI, we need to know what that means. Because everybody's going to be using the term even when it's not actually doing AI. Mm-hmm. That program did that before. No.
Yeah. Well, it's like you mentioned earlier, we've been using AI for a long time. Mm-hmm. It's just not been something that's kind of at the forefront and you're not interfacing directly with it. Usually it's through some of the third party, but I mean, you've seen it before years ago when Google started doing the, the search, and as you're typing, it's already filling in the blank about what it is you're searching for.
Yeah.
Yeah. So all that's been things that's been happening, but the pace in which it is improving and changing now is nuts. Mm-hmm. It is nuts. And when we hit the artificial general intelligence, that's what I was talking about earlier. I said generative, but I meant general intelligence. Once we hit that, I think Sam Altman was quoted as saying, everybody on the planet will freak out for 2 weeks and then we'll all go back to normal. But I don't know, man, because nobody knows what that's going to be like.
No. And so if you look at all of those things, you can understand why every session had some element of it that you were discussing. It didn't matter whether you were talking about it. If the topic was HR, plenty to do with AI there. Mm-hmm. It didn't matter what it was. But yes, everybody's freaking out about it. It's very new. And even you and I are having to learn. So yeah, we're all learning.
We have a relationship with American Institute for Healthcare Compliance, and they've asked me several times about what kind of training can we put together and put a course together and do a certification. course around AI, and myself, as well as a couple other people that are technical in the technical world, we're looking at them going, by the time we get it out there, it won't be relevant.
You can't do that. And you could use it as an element of something else to improve that. But you couldn't.
Yeah. So, they're like, well, what do we tell people? I said, tell them to do an SRA for everything that has to do with it. And often, because every time a new version comes out, that might change something.
And I mean, that could be tomorrow. And what I knew yesterday, no longer valid. So it's moving that fast. This is not something you can wait and say, we'll do that next quarter. You should have done it yesterday. Tomorrow is not soon enough. And definitely next month is a problem. Is really the way.
Yeah.
I mean, the amount of things that I then did after the sessions, like at night and over the weekend, that I went and looked up and studied and put together just to be able to wrap my head around some of the things of how it would apply. And luckily, I understand like the basic concepts, and I've got to go back and say, okay, what am I going to do to teach those basic concepts? Where am I going to put that in the boot camp, David?
On day 4.
Right? I'm like, I got to add it in. There's so much. So it's going in with risk analysis right now, but it's also being added in several other sessions.
Well, we've gotten to where we basically, have lunch, and then we still, we just kind of teach through lunch. And I think now we're just going to have to cut out pee breaks. No more pee breaks.
Everybody's going to get issued a diaper on the way in. Part of your lunch break is go change your diaper.
Yeah, I'll just hit you up on 2x speed, and we can get it done twice as fast.
Yeah, that would make it even harder to understand where I'm babbling.
Yeah. Well, the whole thing about the boot camp is that, because I know we're taking a little bunny trail here, but some people said, well, can you do it on demand, or can you do a virtual sessions and all that? And even though we do have some of that already, sitting there for 3.5 days in this very intensive training stuff is hard enough in person, much less with all the distractions you would have sitting at your computer.
And we've done it, and that's why. But we're trying to build. It can't be the complete boot camp. We've given up on saying we could do the complete boot camp on demand. Just given up.
Yeah.
And so you and I still have some planning to do on making sure that you will be able to do the boot camp concept knowledge, a certain amount of the knowledge. That's what I'm looking for. We still got to figure that out.
Yeah.
But know that there were more discussions about privacy becoming more integrated with security. Price sec. I know, right? I was like, what? And, but then, there, like I said, there's so many things of figuring out on AI. Is my third party using AI, and how is that getting trained, and what kind of controls do they have in place? Do they even know to do this stuff? And what if it's not them, it's the next one down? And are they using my data? And if they're using my data, what's happening with my data? And if I use an AI vendor that I do train and I use PHI, what happens if that vendor goes out of business? Because this is a whole new world. Poof, could happen at any time. We know that. We've seen it. So, I mean,
there's two things I can guarantee. There's two things I can guarantee you. If you go to far enough down the trail, number one, somebody's using AI, no doubt. And number two, they're probably related to Kevin Bacon. So those are the two things I can guarantee.
I was like, where is he going? Okay, so then I'm going to throw in one other thing, and then the last one was, holy crap, this might be happening. So the other thing of my top 3 was state laws, and the Washington state law, My Health, My Data, is everybody is like, this is what we finally see something that may end up being a model for all these other states. And it has so many things that everybody still has to figure out. Because it carves out like the HIPAA PHI data, but not necessarily the entity. And then there's a lot of things like location data. You can only collect it within 2,000 feet or some number of, because you think about the pharmacies and their apps are popping up and they're telling you, hey, you're nearby, come over here, do this. Well, how much of that is are they really collecting? And it actually applies to all of those things and things that could be related to understanding something about healthcare of an individual. And there's, it's small businesses have different rules, but not exclusion like they did under CCPA and some of the other ones. So it is huge. And you have to have like your own privacy policy for that. And it doesn't apply just to Washington residents. It applies to all data collected in the state of Washington, regardless of residency. So you and I could have data up there, and then it would then fall under this law where we have the right to delete. But what does that do about your laws that say how long I have to keep medical records? and then I know, right? And so then I also have the right to revoke the use of the data by certain processors. And then you got to worry about who's defined as a processor and the private right of action. There's a private right of action. So between the geofencing and all of these other things, and it's a broad definition of the data. There's a lot of, it's going to be, as one of the lawyers said, could be a potentially onerous compliance obligation because there are very strict consent requirements. And the fact that could be picked up and used by other states, it's a little bit terrifying. And it was brought up just slightly less than AI. Is the impact of that state law that is currently going into effect, like this, like first quarter, like March 31st, April 1st, and there's some delay for small businesses, but only a tiny bit, not for all of it, just for a part of it. So it is huge. And then the last little thing was a session that I sat into because I was like, I didn't think you could do that. And it is an interpretation of the Fraud Claims Act that the FTC enforces. And these attorneys, it's not used often, but they believe that it could be a whole new ball game and a potential game changer when it comes to penalizing people for health data breaches. There are data privacy elements that could be utilized, and they believe that there is a potential that it could be utilized when you have these breaches because it prohibits knowingly presenting a false claim or knowingly making a false record or statement material to that false claim. So to say that we protect your data in your notice of privacy practices, does that apply? And it only applies to people who are considered government contractors. But if you accept Medicare, does it now apply to you? And what they're pointing out is the government can get triple damages. Whatever's defined as the damages, they can get triple that. There's civil penalties up to like $27,000 per claim. But here's the big kicker. Whistleblower provisions are included. And the whistleblowers get 15 to 25%. And there's a belief that you could collect $2 to $3 billion.
That will be another income market segment, probably within the IT community.
I mean, just think about the number of people that we've had to become therapists for, because they've been given the responsibility of managing privacy and security, and they know it's not being done properly.
Yeah.
Just think of that.
Yeah, because they could just file a whistleblower thing and get paid.
So it's
Or how many times have we been brought in on cases where we're like, dude, you've got to notify patients on this thing, and they're like, nah, we're good.
Yeah. So the failure to specifically, as you say that, I was getting to this point. Perfect segue into this point of if you're submitting claims for reimbursement of Medicare, and under your Medicare contract, you're supposed to follow HIPAA, are now you violating your contractual obligations? And does that make things like a failure to report a HIPAA breach be an implied or expressed legal fallacy? I know.
Wow.
And could it include things like, the private right of action? Because there is one under that. And there, in 2022, and the reason they brought this up, because it was used twice. In 2022, it was used for a contractor who was working. They had a contract with the Air Force and the State Department, and they were required to use a HIPAA-compliant EHR, which they said they did. But they scanned records to internal drives, uploaded them to the EHR, but left them on the internal drives. Okay? Well, here's what happened.
Mm-hmm.
And you and I, here's the moment where I went, oh, crap. Because that was happening, and the staff said, this is a violation. This needs to be cleaned up. But they didn't do anything about it. And the staff kept getting more and more concerned, and finally became whistleblowers. Boom. And then, just for those who say, oh, it won't come after the little guys, the second one was Jelly Bean Communications. A single employee was the web company, got the contract to provide a Medicaid tool. And in that Medicaid tool, they didn't make sure that they had a plan to update the website with security patches. They didn't patch it. They didn't update the site. And guess what happened to it?
You got breached.
$293,000 settlement between the FTC and that single web provider.
Wow.
And that was a settlement. You can imagine. And technically, the question is also, could you do both HIPAA enforcement claims and fraud claims enforcement? Because there's nothing blocking them.
Wow. So I mentioned earlier about the carrot and the stick. It sounds like they may have found a few bigger sticks.
Yeah. So,
wow.
that what they're saying is that they're encouraging everybody to adopt the CPGs to show that you're doing not just the basics, you're doing above and beyond, you're taking this seriously. They're encouraging the adoption of it. Multiple lawyers have pointed out the importance of adopting them, even though they're voluntary. But they also made a point to say, when they were talking about the web guy, the point they made was very important. Small entities should know that they will be treated differently, but it doesn't mean you won't be dealing with it at all. I.e., no, we didn't hit you. We could have hit you with like $1 million, but we know you don't have the resources. It's not going to do us any good. So 293.
Yeah. Like that's easy.
It's probably what they made plus some on the contract that they just kind of went into and thought it was any other website.
Yeah. Better be paying attention. Tell you.
So just know it's about misrepresentation. And the question is, will this apply to you? Will it be used? And, the HIPAA schmippa folks, where HIPAA doesn't have stern enforcement, they're really looking for compliance. I don't know how this would impact them. So is it happening right now? No. But these attorneys that came in special, they normally do only fraud claims, right? They represent in fraud. They say there's a lot of reasons they believe this is about to become an enforcement tool for health data breaches.
Well, I would say you better take that as your warning. So
the pressure to enforce is growing. And rather than, hey, we got to make new laws, it's like, we've never used this law this way before, but there's no reason we can't. It's clearly written in there. Does this scenario meet all of these requirements?
Right. And you don't have to worry about trying to pass anything new. Just enforce what you got.
Yep.
Yeah. You don't want to sit around and go, well, let's just see what happens.
Yep.
So do the right thing.
Yeah.
All right. Well, that's our show for today, folks. That should give you plenty to ponder, think about.
It'd give me.
You should be scared.
Got my attention.
I know. All right. Remember to follow us and share us out to your favorite social media site. If you have one, be sure to rate us and leave a review. We appreciate it. Remember, for Donna and myself, that HIPAA is not about compliance. It's about patient care.
Help me with HIPAA. Let's get it right. Protect your patients day and night. Donna and David, the experts on your side. Help me with HIPAA. Let's get it right.
You've been listening to the Help Me with HIPAA podcast, hosted by Donna Grindle and David Sims. The show created to help you with HIPAA. For more information or to ask us a question, visit our website at helpmewithhipaa.com. Neither Donna Grindle or David Sims are attorneys, and they do not offer binding legal advice concerning regulatory compliance. The information in this podcast should not be relied upon or construed as legal advice in any way. Consult your attorney for legal advice concerning compliance with HIPAA regulations.